Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Amantadine. This amantadine is actually an anti-influenza drug. It is an anti-influenza A drug. It is a dopamine transmission enhancer. This um, also has NMDA glutamate effect is also present in the amantadine. Okay, this amantadine is actually used as an adjunct. This amantadine is used as an adjunct with levodopa, and thus it suppresses the motor functions of levodopa. Thus it suppresses the motor fluctuations which are seen in levodopa, and it also decreases the involuntary movements of the levodopa. This amantadine is a short acting drug with half life of around 2 hours is seen. Then levodopa is actually, sorry, this amantadine is actually eliminated unchanged in the urine. This amantadine has two effects. It has anticholinergic effects, or it also has anti-glutaminergic effect. Okay, then okay, the first contraindications of amantadine. Amantadine, because it is excreted unchanged in urine, it is contraindicated in renal failure. It is also contraindicated mainly in the psychiatric patients, and also it is contraindicated in patients with epilepsy. Side effects of amantadine. Amantadine can develop the patients with amantadine will develop livedo reticularis. So this livedo reticularis is developed due to mainly the local carbonic anhydrase release. Due to the local carbonic anhydrase release, this amantadine will develop livedo reticularis, and ankle edema is also a side effect of a side effect of amantadine. So ankle edema is actually the most common side effect of amantadine.
thank you and thank you for watching.